Well, like you said, this is a follow-up to some reporting we first let folks at home know back last summer. And the gist of it is that there were a lot of Black kidney transplant patients who should have gone on the waiting list sooner than they did. And they were kept off essentially because of some math that included race in the factor. We're now getting a fuller picture of just how many people were impacted by that as hospitals make their adjustments. You're talking 14,000 patients and counting.
Craig Merritt lived with kidney disease for more than 20 years. Last November, he was on dialysis while his kidneys were failing. At that point, he'd been waiting for around 4 years for a transplant.
Some days I didn't think I was going to ever get called.
Currently, more than 88,000 Americans wait for a kidney transplant. 26,000 of them are Black people, according to the Organ Procurement and Transplantation Network.
Particularly Black Americans end up with kidney failure being discovered in the emergency room for the first time.
It has to do with the estimated glomerular filtration rate, or eGFR. Doctors use it to calculate kidney function. Kidneys filter out waste through urine, and the less healthy a person's kidney, the more waste that goes into the blood and the higher the eGFR. Now, the old formula had an extra part just for Black patients that falsely showed their kidneys working better than they actually were.
Race should not have a role in determining how healthy a kidney patient is.
I would have actually been able to start dialysis sooner, and even more importantly, I would have been able to receive my transplant sooner.
230 U.S. hospitals with kidney transplant programs had until January 2024 to go back and credit Black patients for the time they were shorted. The numbers, remarkable.
6 years, 7 years, 8 years of time. It was mind-boggling to me.
The United Network for Organ Sharing tells Scripps News as of January, 14,701 patients received credit for extra time. 2,470 patients have gotten a kidney transplant after they received credit for more time because of the bad prior math. But race is still a factor in kidney transplant. Advocates are now fighting for a policy change on the donor side.
There's a donor risk equation. And unfortunately, yet again, if you were a Black donor, your kidney was, regardless of what the other characteristics of your kidneys were, your kidney was in a way devalued because you got extra points.
As for Craig Merritt, he got 2 calls late November 2023, just 1 day apart. The first,
we went back in and readjusted your time, and it actually doubled. I was truly amazed.
He got credit for waiting 8 years, and the second call that same weekend, there was a kidney for him.
It changed my life.
And in terms of how Craig is doing, good spirits. I just spoke with him this morning. He's at his 3-month follow-up at his transplant center in Charleston, South Carolina, y'all. And when we talk about the future of this story, you know, we mentioned that piece with kidney donors and race still being a factor for those donor organs. We know that the Organ Procurement and Transplantation Network has a policy that they are putting out and waiting for public comment on later this year, when we would see any type of real change with that math kind of being rolled out and a non-race equation being factored in when we're talking about kidney donations. You're looking at early summer at the soonest. Carolyn, Lauren.